Bună seara! Suntem din nou la podcastul lui Damian de Ghici, așa cum v-am promis, avem pastila pentru suflet sau pastila de sănătate și în seara aceasta am onoarea să am un invitat foarte special. Doamna Ela Bănică m-a invitat la un eveniment special la Comitetul Olimpic Sportiv acum câteva zile și m-am gândit, după ce am văzut invitatul care l-a adus special din Marea Britanie, să l-am și eu invitat la mine la podcast și să vă prezint puțin ceva care promovează, care este foarte important. Așa cum ați văzut de cel mai multe ori și eu spun că e foarte important cum respiri, apa, care e foarte importantă, nutriția și mișcarea. Ca să ai un mindset corect și ca să poți să începi să fii satisfăcut cu toate celelalte părți ale acestei roți, ale vieții, cele 8 lucruri despre care vorbesc. În seara asta am un invitat foarte special. Aici am și una dintre cărțile lui pe care le-a scris, Avantajul oxigenului, și invitatul meu este, o să vorbim în engleză și o să-l traducem după aceea, Patrick McKeown. Aceasta este cartea. Hi Patrick, very nice to meet you. Bună, Ela!
Bună seara!
So, please tell us, as I'm saying many times in my podcast and in my meetings with people, even in my academy, I have an academy, it's called Life Purpose. I'm saying that the most important crypto moned or most valuable thing in the world, it's before time, before energy, before love, it's actually oxygen, breathing. This is the most important thing, because this thing, if somebody closes this for 3 minutes, we are done. And it's also not in our control. So please explain us how important is this O2, how important is this, the oxygen and the breathing for us, for humans?
Yeah, I think you've said it. You know, we as humans, we can survive without food for weeks, water for days, air for just a few minutes. I think another question comes out of that, Damien. How can you breathe in a way to improve oxygen transfer from the lungs to the blood? And how can you breathe to improve oxygen delivery from the blood to the tissues? Because there's a lot of misinformation out there about breathing. There's a lot of ideas out there that the more air you breathe, or you take a deep breath or take a full breath, that you're going to have more oxygen going throughout the body and more oxygen getting to the cells. And that's not correct. So just with food, we must eat a certain amount of food every day. Not too much, not too little. With water, we must drink a certain amount of water each day. Same thing. But with breathing, it's the same. It's not about more air, the better. With breathing, we could argue that with breathing, less is more. So, because very often with modern living, our breathing patterns change, and it's very common to have poor breathing patterns. So what it means is that if our breathing is faulty, it's going to have a knock-on effect then on other aspects of our life. And you talk about oxygen being the most important. I actually think being able to bring a quietness to the mind, to have a certain calmness, that you're connected with your attention simultaneously with time, that we're not thinking, we're not lost in the head, we're not living our life stuck in the head as most of us do. Well, breathing plays a role with that. So from a physiological point of view, the brain, by controlling breathing, regulates its own excitability. It's actually quite a famous sentence that comes from a paper back in 1988. So yeah, oxygen is important.
In this era that we live, and then I want you to tell me about your story, how you started with this 24 years ago, I understood. In this era that we live, and that's what I like about your presentation yesterday, and also what Ella was saying, it's obvious before we started the podcast that for everywhere you see, or maybe on my algorithm on TikTok, Facebook, and Instagram, when I look, because they know what you look and they send you more information of the same. But for me, at least in my universe, I see everywhere depression, anxiety, not present, depression, anxiety, trauma, OCD, ADHD, all this constant talk. Maybe this is my reality, but as I can see in many circles, everybody start to be more aware of this and about being conscious, about being mindful, about awareness, about high consciousness, and how And what is your recommendation? Because I know you work also with famous people, as you said, with Chris Martin for Coldplay, with the people from Special Operation, with musicians, artists, sports people that they have to deal with stress really. And I'm not saying that only artists, myself and musicians, sports or Special Operation or doctors, they have everyone has to deal with stress at their own level. But my question is another one. What are some of the, of course, easiest ways that people can find a way to become aware of their own breathing patterns and to get out of their own head? Because it's obvious that this overthinking, this rumination doesn't do anything else than create more and more anxiety and more thoughts and more of us living in the past or in the future, but never in the present.
I think breathing and sleep. I don't think we can look at breathing in isolation, but breathing would be a foundation, and how we breathe during the day will influence how we breathe during sleep. None of this is new. You know, I've seen papers written back 100 years ago talking about the importance of nose breathing, the vital importance of nose breathing in sleep. We had the top sleep doctor in the world, Dr. Christian Guilleminault, who coined the phrase obstructive sleep apnea. He developed the apnea-hypopnea index, and he wrote about the critical importance of restoring nasal breathing, both during wakefulness but also during sleep. So here you have the top sleep doctor in the world talking about it, but yet nobody seems to know about it. 50% of the adult population wake up with a dry mouth in the morning. If you wake up with a dry mouth in the morning, you spend more time in light sleep, less time in deep sleep. You're more likely to have obstructive sleep apnea. We're more likely to have upper airway resistance syndrome and to wake up exhausted. Now, if we wake up exhausted in the morning, the mind is not calm. And if we look at the instance of people with depression and exhaustion, I remember a client come in to me about 10 years ago. She was about 30 years of age. She had depression. And I just asked her the question. I says, how do you feel when you wake up in the morning? And she says, I wake up absolutely exhausted. And I said to her, has anybody, now she was going to doctors and psychiatrists, has anybody ever asked you about your sleep quality? And she said no. So I would suspect that on the basis of that, you have to ask the question, if she does a sleep study and she could get a positive diagnosis of obstructive sleep apnea, she's getting treated for depression. Is it the obstructive sleep apnea that's feeding into depression, or depression feeding back into obstructive sleep apnea? It doesn't matter. If you're only focusing on depression, as long as she's waking up feeling exhausted every morning, it is a problem. We also know in some papers, up to 73% of people with PTSD have poor sleep. Like, I'm working with a client with chronic fatigue syndrome, a musician as well, like yourself, 30 years, exhausted. Now, I'm starting with him in terms of getting the body to tell the brain that everything is safe, but also looking to improve his sleep. And I've only been working with him for about 3 weeks or so, and now he's starting to sleep throughout the night. Now, if we think about chronic fatigue syndrome, how on earth can we get optimal energy if we have lousy sleep? But we don't get good sleep quality if our mouth is open. I'm just going to go one circle, because you know this paper as well, Ella. It was a study conducted in Stratford-upon-Avon in the UK. They looked at 11,000 children, and they looked at them from 6 months to 57 months, and children who were mouth breathing, apneic, just stopping breathing during sleep. And for a child, they only have to stop breathing for 2 breaths, and it has to happen once an hour. So it's different to an adult. Or snoring. These children, if they were having sleep disorders at age 5 and untreated, they had a 40% increased risk of special education needs by age 8. Wow. The brain grows during the early formative years. And again, so like, I come into this because of my own health issues. Anybody who works in breathing, we normally fall into it. We don't choose it as a career. It chooses us. I was a chronic mouth breather, always had problems with my nose. I had exhaustion. I left school at 14 originally, never to go back, because we're sending kids, they're inside in the classroom, they're supposed to be able to pay attention to what the teacher is saying. They have no concentration. You know, we can't judge children academically and tell them if they're intelligent or not based on what they're getting in terms of grades, if we're not looking at the very foundation, what improves cognition. And that's sleep, and that is breathing. There's 2 serious factors going in there. But there's a lot of children, they're going to fall through the cracks. And then frustration sets in. They don't have the same self-esteem. You know, their quality of life is sacrificed as a result of, I think, an overlooking. You know, the medical profession have overlooked the importance of nose breathing. It's so simple, but they have overlooked it.
Thank you. And I have to say something before I ask also Ella something. About 13 years ago, I went to Dr. Amen, if you know him, that he does also the spectrum with the neurotransmitters. He does a scan of the brain. And the first thing he said, okay, you may have a depression, anxiety, whatever. And he said, I want you to go to a clinic. I want you to sleep there to do a test for sleep apnea. And I'm like, look at this. It seemed crazy to me. I'm like, what does it have to do with depression with a test for sleep? And I did a test, and I was having every minute, like it was really horrible. And the longest was like 58 seconds. You can imagine, like, and the guys in the morning, they look at me and they're like, oh my God, this is like really, really horrible. And I had to wear a mask for about several years, and then it went better. But in the last year, I feel like I'm having again problems. For the last 5 or 6 months, I felt it. And I know that you work also with something you have the clinic Ortho, and I want to tell us about how important it's also for the people. First of all, I know that we translated the book of Patrick, the position, because we talked about something before. I was about a couple of months, I had a big concert in the Sala Palatului, which is a huge hall here. And I have a lot of members of my band. I have about 30 people in the band. And I never said that officially, but now I'm saying it. And I just finished before a 7-day fast, or water fast. And you know yet that you are a little bit in La La Land after 7 days of nothing eating. And I was looking at some of the guys coming to the rehearsals and the way they were eating. They are from the younger generation, 25, 26. And I could see in that state after the fast, I'm like, I could see the way they work, what they're going to become in life. I don't know if you understand what I'm trying to say, because you could see the way somebody carries themselves. And I was talking to Ella earlier when we were waiting for you. I'm like, I really want to talk about this, because I really believe it's very important, not only from a standpoint of view that you go to the gym, okay, you make your back muscles and to always stay straight. But it's important the way you stand, even, and that affects also your breathing, that affects also the way you think, that affects also your mood. Everything is stabilized to the way you sit and you stand. So please tell me about this, Ella.
Well, you're completely right. The posture, it's very, very important. Breathing first, but then the posture also is important. So we are made by bone, muscle, ligaments, fascia, for example. That's why many other things, but this is the things that I would like to discuss now. As you said, you could write, you could tell how the life of someone will be related with the posture, with the problems. And you're right, because everything is connected. Our approach is holistic. We are working in a multidisciplinary team, and everything is influencing other system. For example, posture can be influenced by breathing. When you are breathing right, in time, for sure, the posture will change, because we cannot, unconsciously, our body, our head position is changing by doing a hyperextension, unconsciously, because the body wants to open the airways. The brain knows that we need to open the airways, we will sit like that, but we cannot walk looking on the stars, so we became forehead posture. Our head will go in a forward position. So this will put a lot of load and will change the cervical spine, and of course all the spine and all the body posture. This will change the diaphragm and the muscle function also, which is aggravate the breathing posture. This will change everything in the body, even the position of the organs. it will be influenced. So all the energy and everything in the body will not be correct. Other things, it's very, very important, the fascia. There is a fascia system, which in fact is an organ. Very few people talk about this
fascia.
and
I
know about
myself
this.
and my wife, we are following some people, the Human Garage, and people that talk about
Exactly.
the trauma that is stored in the body through the fascia.
They are
The body work.
Unfortunately,
Unfortunately, we don't have anybody in Romania doing that.
Restrain. I know someone doing. There is called some restraint in the body in the system fascia. For example, it could be caused by an accident, by emotions,
Emotional trauma that is stuck.
even birth trauma, many things. Also an injury or a bad posture, many even some problem with organs probably. So because the fascia is also in
the organs,
in abdomen.
Yeah.
And of course for everywhere in the body. So everything is related. If we have some problem with fascia, some restraint in the body will influence and will change the position
The way
immediately. And the position of the breathing organ and everything is related with each other. Also, there is something very, very important. The what they are doing in craniosacral therapy, there is the cerebral fluid.
Spinal fluid.
Exactly,
Yeah.
spinal fluid, which also very few people are considering and talking about. There are many researches and articles demonstrating that this is also important. And other things, for example, that starts at the birth already, or probably in the womb, because the pregnant woman has advised to take acid folic, for example, which there's some studies showing that folic acid is causing a tongue tie, which will influence the breathing, will influence the body posture. Then, at the moment of birth, the majority of the women, especially in Romania, are doing C-section.
Yeah, which is
when we need to do
trauma.
Yeah, it is a trauma. And related there, we're talking about the cerebral fluid, spinal fluid, that has a rhythm, flux like the breathing and like the blood. And when they are doing C-section, the newborn doesn't have a correct rhythm or flux in the spinal cerebral fluid. So it doesn't set up like a normal natural born child. So immediately already it came with some problem. So there are so many things connected with each other
that we are not aware. And what you said about before the folic acid, I'm following a very interesting guy in the States, Gary Breccia, and he's talking about this thing with acid and methylation. Most of the people they don't digest, and they don't have the methylation inside of them.
This is an epigenetic problem that it's very, very often found in these days.
And most of the people, they suffer from depression and anxiety because they don't have methylation.
Probably it was many years ago, but maybe people didn't know, or something changed, because everything's changing in the universe, not in really in good, but in bad. Foods, additives, a lot of things, that pollution, vaccines, medicine. I know our body's getting so many influences. So this epigenetics influence is having an important role, because the child came in this world already with some sensitivity in the body.
And all these transgenerational trauma.
Exactly. Gluten sensitivity, lactose sensitivity. So the problems start from here. And also the cognitive tissue is affected. And this is everywhere in the body, even related with the breathing, related with the development of everything, and nutrition, as you said.
Do you really believe, Patrick, that I'm quite sure that, I don't know, maybe, I don't know percentage, because I'm not a specialist, but a huge percentage has to do with the sleeping and the breathing for depression and anxiety. I'm not even approaching a different subject, because I'm sure there are many organs affected for sure. But I wanted to approach this because this is one of the major things now on the lips of everybody and everywhere. So it's obvious. So I would say the sleeping and the breathing. And then after what was the longest or the shortest 3 months, 6 months that you've seen huge results or different results in terms of after taking care of the sleeping and the breathing with your patients?
Oh, in terms of breathing, it's quick. And I'm not going to oversell it, but I would expect results in 2 to 3 weeks.
Wow.
Like, we have a cameraman from Switzerland who's doing a documentary on this, and it's actually his wife, and she has obstructive sleep apnea. She's going to do a pre-study sleep test. I'm going to work with her for 4 weeks, and he's going to do a post-study sleep test, but he's also going to document it. It's going into a documentary.
I'm going to do another documentary for Romania. I want to be your next client.
So the results are quick, you know. It's all down to people putting it into practice, though. And we have to ask this. If we're breathing fast and hard in sleep, of course there's negative pressure in the airways. And we know that sleep medicine has changed in the last 10 years or so. They've recognized that it's not just about the anatomy. You know, you have people with good, you can have, okay, the anatomy I'm talking about here is the narrowness or the you know, the width of the airway itself. But there's 3 other dimensions there. One is your breathing patterns, your sensitivity to carbon dioxide. One is whether you're a light sleeper or a deep sleeper. And the other is whether the muscles in the throat, which are designed to keep the airway open, are actually doing their job. We can influence that by breathing. You know, but the simple things of breathing in and out through your nose all the time, having the tongue resting up in the roof of the mouth, and also understanding that if you want to improve your blood circulation and change your breathing patterns, don't be taking these full big breaths. It's unnecessary. You know, you never see a dog or any animal out in a field hyperventilating because they believe it's good to be breathing more air. The cheetah, the fastest animal on earth, does everything with its mouth closed. The racehorse, mouth closed. Only if these animals are sick will they revert to mouth breathing. Human beings, our ancestors, were innate nasal breathers. Young babies are born breathing through their nose for the first 6 months of life. You know, then of course they may get an airborne nasal stuffiness and they switch to mouth breathing. So nose breathing is innate. Now, when we are breathing through the nose, we've better recruitment of the diaphragm. When we have better recruitment of the diaphragm, the throat is stiffer and less likely to collapse. But also when we're breathing through the nose, we're breathing lighter. When we're breathing lighter, we're not having that negative pressure in the throat. You know, doctors look at sleep medicine, and if a doctor is looking at sleep medicine solely from an anatomical point of view, he's not asking the question, what is the flow that's going on here? You know, a plumber coming to a house, the plumber is bringing the water from, say, the mains to some other part of the house. The plumber is going to select the diameter of the pipe based on the flow that's going through. But in sleep medicine, all of the attention goes on the size of the airway. But very little, if anything, is going on the breathing pattern that's contributing to that resistance.
How much it goes inside.
And that's what we need to look at, you know. It's so vitally important because we have to look at sleep medicine from a children's point of view. The gold standard of treatment is remove the adenoids and tonsils. We know if the child doesn't learn to nasal breathe after that, there's a 68% worsening in their sleep within 3 years. So it's only short term. We have hundreds of thousands of children getting their adenoids and tonsils removed, and there's no attention paid to whether the child is breathing through the nose post-surgery. And also in sleep medicine for adults, the gold standard of treatment is a CPAP machine. 50% of people abandon it within 3 to 6 months. So here we have the best solution that medicine has to offer. And both for children and for adults, it's a problem.
And it doesn't work.
Well, it works, but people can't tolerate it. And if they're not using it, then it doesn't work.
Exactly.
You know, I would agree with you there.
I've seen in the latest post on Instagram that the famous tennis player, the girl,
Iga.
Exactly, Iga, and then Erling, the football player from Manchester.
Yes.
That both they tape their mouth in order to have better results.
Yes.
I wanted to try this because I felt that I'm snoring during the evening, but I kind of was afraid. So I'm like, what if I have my mouth in I can breathe or whatever. So please develop more about this thing with the mouth, the tape mouth.
Yeah, like we started doing taping of the mouth 23 years ago. I found it was a game changer with me. Now, the first few times that I did it, I wore a nasal dilator, a breathe right strip, because I too, because of nasal issues, now we can show how to open up the nose, but it can take a little bit of time to really get the nose working. It can take a couple of weeks. So getting
I
them
used to
out.
wear those too, that it opened the air.
And the question to ask Damien, you were wearing these, but were you actually breathing through your nose? Because sometimes people are wearing these, but they're breathing through their mouth, and then it's a waste of time. But you know what? You could do both. So this is based on the Cottle maneuver. If you put one finger here and one finger here, and you just prise your nostrils, it feels easier. So because you're expanding the nasal airway, the taping of the mouth is really, really important. But I would say is, do nose unblocking exercises to unblock your nose first. Breathe through your nose as much as you can. The more you breathe through your nose, the better your nose works. And then, if you're waking up with a dry mouth in the morning, you need some support to bring the lips together. Now, we have a tape, and I'm not going to talk about it because it's just a tape. It would be better if it's surrounding the mouth to pull the lips together as opposed to just covering the lips. And the reason being is because if we have somebody with moderate to severe sleep apnea, if you just taped across the lips, you can worsen their sleep apnea. And studies have shown this to be the case. And the reason being is because they're not allowed to mouth puff. These people need to breathe as well. And if, for example, I know mouth breathing is bad, but you have to breathe, whether it's through the nose or through the mouth. If you have somebody with severe obstructive sleep apnea, they're breathing really, really hard, they have a tendency for mouth puffing. They have to be allowed to mouth puff. And that's where a tape allows that.
Usually, at the massage, when I fell asleep, and I hear, I'm waking up myself, so I know what you're talking about. So, but mouth breathing, you said also for some sports people, it's good while they're doing actually in the middle of the sport, because they make them more conscious to breathe through the nose, so they have better performance.
Part of the training, like people might be looking at Iga there and they're wondering, like, why is she doing that? The reason that we have our athletes breathe in and out through the nose is because it adds an extra load to that athlete. It's tougher. You're breathing through your nose. You're not getting as much air. But if you do your physical exercise with nasal breathing, you're training your body to be able to do that physical exercise with less air. And then if an athlete then can go out and they can do, their same intensity of exercise with less ventilation, there's an economical saving there. They're less likely to gas out. There's more reserve in the tank. So literally it's like a car. You will have a car outside that's doing maybe 20 miles to the gallon, and you'll have another car that's doing 50 miles to the gallon. We want to have a great engine, but we also want to have that car efficient. The athlete is the same. Don't waste energy unnecessarily. So we train breathing to add an extra load onto the diaphragm to strengthen it, but also to improve breathing from a biochemical dimension. In other words, training the athlete to be able to do the same intensity of exercise with less ventilation.
Wow. So that's one of the main reasons.
Oh, it's a huge reason. Now, sometimes people get the idea then that you have to be sprinting with your mouth closed. No. It's adding an extra load that you can sustain nasal breathing, but you still have control over your breathing. Like, it's not doing something stupid. We don't want to be pushing it to the extreme that it's excruciating and you're forcing all of this air into your nose and your nose is getting sore. No, it's not about that. It's doing physical exercise, but it's ramping up the pace. And over time, typically with physical exercise, we would say, yes, initially, in the first few weeks, the air hunger is higher because the gas carbon dioxide is accumulating in the lungs because it can't leave the body quickly enough through the nose.
Yeah.
But if you continue doing your physical exercise for 4 or 5 weeks with your mouth closed, the air hunger diminishes. Now you've got a higher tolerance to carbon dioxide. Carbon dioxide is the driver to breathe. We breathe the stimulus to breathe is carbon dioxide. It's not oxygen. People think it's oxygen.
It's actually the exhalation, not the inhalation.
Correct.
Ella, so tell me, how did you start working with Patrick, and how did this all came around about translating the book and being so into this into this new approach about the breathing?
So it all started when I switched from classical orthodontics. Aligning teeth from aesthetic point of view for beauty. When I switched to health more, or to integrative or holistic approach, because I was searching for the causes And also I analyze what can be done by having a stability in time of the treatment, because if you don't treat the causes, it will relapse for sure. So we cannot give the patient the retainer for whole life, because it's there are some reason that is not good for them. Or they are not wording it, or they will relapse because nobody was looking at the causes. So I can do with my own hands fixing the structure. So I can fix the structure of the bone, of the maxillary bone, and I can fix the muscle by doing my functional therapy. We are training the muscle of the face, of the mouth, of the tongue, of the pharyngeal zone, and also we are working in team with others, with osteopaths, with some other therapists. But also we need to retrain the breathing, because the breathing, as I saw in the clinic, in my experience, the breathing is the main cause, the main factor causing malocclusion. Because the breathing pattern is not correct, or they are breathing with the mouth for long, because okay, it's normal to have a stuffy nose or a virus for 1 week or 2, and you cannot use the nose properly. Everyone can have, but there are many children, they develop a habit and they will continue to breathe with the mouth, and it will continue forever. So for sure they will develop malocclusion. Every children, they are having malocclusion, are having breathing problem. So even if I send them to the ENT, we have a lot of ENT collaborator. So I send them to ENT, they perform surgery, and the kids are continues to breathe by the mouth, not by the nose. So, and unfortunately, I try to educate, I try to inform the ENT that the breathing, it's a function that must be retained, correct, the help, and it doesn't correct by themselves immediately. Or it's not enough that the mother said, close your mouth and now breathe with your nose. No, because as Patrick said, it takes weeks, it takes sometimes months with kids, or depending on what other problems they're having. It's not so easy all the time. I found it quite difficult, because you have to have the willing, you have to want to do it, to change the lifestyle in the family, in your personal life, because it's not enough that the doctor or the mother say, close your mouth and breathe in your nose. It has to be,
Yeah, you have to be aware.
yeah. So that's why I was.
So tell me about how did you meet Patrick?
So I met him in London when I did the first training, because everything that I want to include in my team, or in my multidisciplinary team, I go first to study, to understand better. Even if I'm not working all the time in all therapy myself, I have diploma in myofunctional therapy, I have in breathing training, but it doesn't mean that I spend all my life doing breathing or myofunctional or something else. But I do a little bit of all, but I don't have time because I have so many patients. But first I need to understand, and I need to understand everything, and then I need to know what to ask to my staff or my therapist in order to get better results.
So when you've seen Patrick and he started talking about this thing,
yeah, I've met
said,
him.
I have to bring him to Romania.
Absolutely, because I translate a book, and the people, the awareness is very important, and to understand the importance, it's better to learn from the author, from the one who is the best in the world. Because if I am talking, probably it is not the same importance like he will say, because he has a lot of experience with, not only with patients like I have. He's working, as he said, and you said, with special force, with sport people, with musician. I cannot say that I'm working with special force, so I have other experiences, so he can cover everything. That's why we invite him, and that's also we are working already with some sport team in Romania. There are some professional sport people. They are trained by Patrick personally, because the breathing training is not the same for everyone. For each patient, each person, he made individualized program. So this is very important, especially for a professional like you, musician, or a sport. I can help children, teens, adults also. I have many patients, kids and adults with sleep apnea or severe problems. But a very top level professional sport, we can help them to work with Patrick directly, which can change their life, from first place, second to first place, or to be on
It's a huge difference.
on the podium or not. I mean, it's a huge difference.
Thank you. This Patrick, like as Ella said, it's about performance, but sleep and breathing, first of all. From what I understood, you wrote about 9 books, and you're a specialist, one of the top specialists in the world in this genre. It's obvious that it affects everybody on the level of the depression and anxiety, and as we said, all those things at the mental level. But I'm sure, and that's what I wanted to ask you, that it affects also the heart and the other organs, the liver and other things. What other things have you seen that the breathing patterns, it really affects really badly? I suspect the lungs and the heart very much, no? Or I don't know, that's why I'm asking you.
Sick people don't breathe well. And you could ask the question then, what's causing what? So if you have somebody here with type 1 diabetes or epilepsy, you look at their breathing patterns. Their breathing pattern very often isn't good. They're breathing fast, they're breathing upper chest. See, when we have a sickness, whether it's a physical or a mental sickness, it puts the body and brain into an increased stress response. Now, if you then have an individual in a continued stress response, they're not going to heal so well.
Yeah.
Because there's a fight going on there. So we use breathing as an inroad, and the scientific aspect is that on one level we're helping to strengthen what's called the baroreflex, which are the pressure receptors in the major blood vessels, to make them more sensitive to fluctuations in blood pressure. This way we're also improving cardiovascular health. But also when we can strengthen the baroreflex, we have to bring the autonomic nervous system out of that fight or flight response into balance. But on another level, we're increasing in vagal tone, so stimulating the vagus nerve. And we can do that through various mechanisms. But we also have to think about sleep. Because if we were working just with breathing during the day, but if that person is having sleep apnea at night, the work that we're doing during the day,
Nothing.
well, it's so you can see that there's this 3-way communication. I'm going to go back to what Ella said as well. There's seldom a realization with parents that if you have a mouth-breathing child, it actually alters the shape of the face. Now, and there can be a debate about this, and you can say, well, how much nasal obstruction is necessary, at what age of the child, etc. Google a term called adenoid faces. Adenoid faces. This term originated in 1872. It's a long time ago.
I have an adenoid face.
No, you don't.
I'm kidding.
But if you put in adenoid faces into Google, you will see these faces of children, and it doesn't look good. And the adenoid refers to the enlarged adenoids at the back of the nose. That didn't cause the problem. It was the enlarged adenoids which were causing mouth breathing, which caused the face to go longer. The tongue is not resting in the palate. The face is narrower. The palate then is up. It's a high palate with malocclusion, is overcrowding of teeth. How many children have crooked teeth? Crooked teeth is a sign that the jaws are too small. So we have a major conversation to go on here. And genuinely, even though you can go into PubMed, which is the national database of scientific articles, and put in oral breathing malocclusion. And I remember, I think the last time I did it, it pulled up 700 papers. There's a load of information that's there buried in the scientific literature that's not getting out. I'll give you an example. I did put a chapter about cardiovascular health in that, but I also put a chapter about the craniofacial growth that Ella was talking about. And one of the publishers didn't want to include a chapter. It was either the US publisher or the UK publisher and the Japanese publisher. And I said, why won't you include this chapter? And they said it's because it's going to upset the readers. And I said, this isn't for the readers. I said, this is for the readers' children. So they put it in one of the publications, but they didn't put it into the main body. They put it in the appendix where nobody will find it. Okay. So, it's kind of, it's kind of bizarre in a way that the information that's there, that's been around for decades. I was this mouth-breathing kid. There's hundreds, thousands, between 25 to 50% of studied children persistently mouth breathing. These kids are not going to reach their full potential.
Incredible.
Even the famous Christian Gimino, the doctor from US, said the same, that we must prevent and we must act when they are children, when they are growing,
Yeah,
to
yeah.
prevent sleep apnea. In
Before.
fact. Exactly.
Now, if I get a chance to have you here, I would have to take advantage of this. And for our public that it's not going to have a chance to do the exercises that we've done yesterday, what can we do? So usually I like to be like a guinea pig, that I ask people to do the experiments on me. What can you show us so that can help people when they are in a state of anxiety, panic attack, general anxiety disorder, or when they are stressed, something to calm down? Some couple of small exercises or some little bit that they can use whenever as a tool.
Yeah. I'm going to approach this from, if somebody is having panic disorder, it's a little bit different than somebody, a normal person who's not prone to panic. Say, for example, some people get stressed by focusing on their breathing. If, for example, you're a person who's prone to panic disorder and you're very uncomfortable about focusing on your breath, then don't focus on your breath. Do small breath holds, and this will help to bring the body and mind into relaxation. Take a normal breath in through your nose, out through your nose. You pinch your nose and hold. 5, 4, 3, 2, 1. Let go, but breathe in through your nose. And now just breathe normal, and it should be silent. And again, take a normal breath in through your nose and out through your nose, and pinch your nose and hold. 5, 4, 3, 2, 1. Let go. And now to just breathe normal. Every time you do a little breath hold like that, carbon dioxide increases in the blood and increases blood flow to the brain. I think we can all picture the person who's having the panic attack, which is acute, and they're losing so much carbon dioxide. They're handed a brown paper bag, which is not ideal, to trap the carbon dioxide, to rebreathe that gas into the lungs, to increase it in the lungs, increase it in the blood to increase blood flow to the brain, and then the brain will calm down. If we hyperventilate, it causes arousal of the brain. Now, when you do that small little breath hold, you don't have to focus attention to your breathing, but it's increasing a little blood flow to the brain. Another exercise that somebody is feeling highly stressed and they don't want to pay attention to their breathing, but I think one of the best exercises is to go out and go for a fast walk with your mouth closed. It is a breathing exercise in itself. You know, you're walking with your mouth closed, you're deliberately increasing carbon dioxide because you're producing more of it.
Yeah.
It's increasing in your blood. You feel more air hunger, but it's okay because it's with physical exercise. But that's increasing blood flow to the brain. And also when you walk or do your yoga or dancing or whatever you do with your mouth closed, you also have better recruitment of the diaphragm. So it's a breathing exercise, but only if you have your mouth closed. Like, as I was saying, when we went to the conference yesterday, I was in your car, and I was looking at people on the streets of Bucharest, and they were walking with their mouths open. Why are you walking with your mouth open? Your mouth is not for breathing. Another exercise that you could do that we use a lot with our panic is simply humming. And I know it sounds a little bit strange.
No, I know this about humming. Please tell me.
So humming will stimulate the vagus nerve, but also when you hum on an exhalation, it actually slows down the speed of your breathing. See, we want to slow down the speed of the exhalation. When we're stressed or when we're anxious or when we're panicked, we breathe out fast. We breathe in fast, but we breathe out fast. And breathing out fast, that's going to keep us stuck in that state of agitation. So if somebody wants to calm down and again they feel uncomfortable focusing on the breath, they just take a breath in through their nose and they hum on the exhalation. And even just doing it a few times over 1 to 2 minutes. And what that will do is it generates and increases nitric oxide in the nasal airway. You breathe back in, you're carrying this nitric oxide into the lungs. It's slowing down the speed of the exhalation and it's stimulating the vagus nerve as well. So there's a few different exercises, but the one that I use as a go-to anytime that I'm feeling that there's a bit of pressure on, a public event or anything like that, or if I feel my heart rate has just gone up a little bit too high, I simply focus on the speed of the inhalation, soften the speed of the inhalation, and have a really relaxed and a slow and a gentle breath out. Anytime that we breathe out slow and relaxed, our body is telling the brain that we're safe. Even if we just remember that. In and out through the nose, slow, with a prolonged, gentle exhalation. And it's good.
Wow, incredible. So that will be one exercise.
It's one exercise. Like, breathing is multidimensional. When people talk about breathing and they think it's maybe yoga breathing, it's different. No, it's not. I often feel that breathing has been forgotten about, and the people who are teaching breathing don't necessarily know the detail of breathing. To how, there's oftentimes with breathing, there's just an instruction that give out there. But what does it do when you do that?
Exactly.
Like, from the
Or
physiology.
normally, if you go to the pharmacy and you say, "I cannot breathe," oh, they give you something to. That's not the point.
But I think it's understanding the power of breathing. It's breathing isn't this just woo woo thing over here. Like, and very often it's taught as this woo woo. Forget about the woo woo. We need to get breathing right down the center.
It's so essential.
Well, there's two skills that we are not being taught in school. We spend 14 years in formal education. We're not taught how to concentrate. We're not taught how to deal with stress. Now, for me, they are the two most important skills that we need for life. So what is concentration but your ability to hold your attention? For that, you need sleep, deep sleep, but you also need functional breathing. In order to deal with stress, you also need deep sleep and you need functional breathing. It's been overlooked.
They are combined.
They are combined.
Please tell me where people can find you.
We have Instagram and all of the social media. Oxygen Advantage is the handle. Oxygenadvantage.com, and then all of the books they're in Amazon.
Are there any
etc.
videos with you? Are there any master classes people they can watch
Yes.
you if they want to learn applications and anything?
Yeah. So I launched an app last year, and I funded it myself, and the cost was $150,000. The only
Wow.
reason that I say that is because I was committed to producing an app as best as
Nice.
I could. And we said the app is going out for free. That's it. There's no subscription in the app. So the whole purpose, because I think that breathing has been held back, and I couldn't figure out how is it being held back. Now, there's a greater awareness now of breathing than there was when I was teaching it back in 2002. But it's still only the innovators, the early adopters.
There are only few people talking about you, Nestor, and I've
Yeah.
seen a couple of the podcasts of Huberman
Yes.
Lab that he's talking about the thing with the to breathe
the
things and then
physiological sigh.
yeah.
And like, again, the physiological sigh has its use.
it doesn't work for me. I've been trying it. Nothing to say, Dr. Huberman, but it doesn't.
No,
work.
but this is where breathing has to be tailored. You can't, like, the problem that I would have with a physiological sigh, that if you're taking a 3/4 breath, you pause for a brief second, then you're taking the last final
Yeah.
piece of the breath, you're filling your lungs with air. Okay, it could be 2 to 3 liters. If you are then having 6 or 7 of those breaths over 1 minute, well, 6 or 7 by 2 to 3 liters is 15 liters of air.
Yeah.
It's hyperventilation. So on one hand, it's causing the body and mind to calm down, but on the other hand, it's causing overbreathing, which is causing arousal. So this is where we need to break it down. This is where, when you're working with somebody in front of you, you look at their breathing patterns, and this is what I tried to do with the app. You put in your Bolt score, and also you put in your individual issues. If I'm working with somebody with panic disorder, it's very different to somebody with asthma. Or if I'm working with an athlete or a boxer that's coming in
Definitely.
that he wants 1% extra, it's different. And breathing is the same. It has to be tailored.
Wow. So usually I ask, and I want to ask both of you, at the end of my podcast, I usually ask to tell me, out of all your experiences, especially in what you do in your job, profession, or actually your passion, because you're so passionate about both of you. What would be your advice for the people that are watching us? Usually we get hundreds of thousands of people that they look at us in terms of the breathing.
Well, in terms of the breathing, I would say first check, do you wake up with a dry mouth in the morning? So check that straight away. Check in on your breathing as you're sitting there during rest. Do you feel air hunger? Is your breathing a little bit faster? Are you breathing upper chest? And then you have to consider, well, what is my breathing pattern telling the brain? Do I want my breathing to be constantly telling the brain that I'm in this constant stress response? Because the problem with that is that we then aren't resilient when we do have a difficult situation. So we want life to be a bit softer. You know, there's one thing about observation of the breath, but there's another thing in terms of changing your physiology. And life is softer because you can take it more. You can deal with the ups and downs more. Like, what would I say from the last 25 years for me, just practicing changing my breathing and practicing breathing. And I don't do it like, I'm not an obsessive person at all. I probably was back at one point. It helps life that it's a bit softer. That's what it's about. Yeah.
Ella, please tell me.
Well, because I'm in charge with prevention, I think many problems, health problem, including breathing problem, can be slowed down at least, or prevent or cure if we start early. So when we start early, we start with the future mothers by giving them correct advices, because during the pregnancy, usually the mother is more open to get some information. It's allowing herself to read and to find out and to do research. Then immediately after the birth, we can do a checkup. We can give them advice, and also we can help them working with a multidisciplinary team what to do in order to keep the breathing correctly, what to avoid and what to use to help the child growing correctly. Because in a way, with what I'm doing, being an dentofacial orthopedics more than an orthodontics mean just straightening the teeth from aesthetic point of view, or dentofacial orthopedics meaning correcting the skeletal of the face, and pedics comes from an early age in the childhood. So we are in fact the guardians of the airways, so we can help them by preventing many things happen. So I advise them to do the checkup as early as possible, to inform, to research, to do some research, because from my point of view, the orthopedic or orthodontic checkup, it's a must. Not a choice, or you don't wait until you see the crooked teeth after 6, or the permanent dentition is in place.
You don't want to wait until it's too late.
Yeah, you start early. Even the American Association says that the first orthodontic checkup must be done before 7 years old. I said it's better to start as early as possible.
I will bring my son.
Prevent by since birth, and also we start treatment at 3 years old already. Wow. So before 6 is ideal. So we treat kids as early as possible. So of course the problem will be cure or prevent, or it can be at least make them not severe, not to, as you mentioned, and you mentioned also, Patrick, about many patients having severe sleep apnea, which is causing a lot of problem, and mentioning about what's causing dysfunctional breathing can cause cancer, can cause Alzheimer, very, very bad problems, minus 10 years of life, stroke, a heart attack, and so many complications. Exactly.
With sleep apnea, it's huge, and it's so common. It's 25 to 50% of men.
And sleep apnea doesn't mean that the patient needs to be obese or old. Even children are having sleep apnea.
Yeah, 2 to 5% of kids, 10 to 15% of children are snoring. No child should snore. That's simple as that.
Exactly. Or grinding the teeth.
Grinding the teeth
during the
as
night.
well.
It's not normal.
Yeah.
The parents should know about this.
Yes.
When they hear a child snoring or grinding the teeth, they should do a checkup.
Like, I think ultimately, it's about we wanting to achieve our full potential. And there's something inherent, like...
Especially in this era that we have information on everything. And everybody, it's digesting so much information, and so much is like the best, we live in the best time of any time. So at least now that we have so much knowledge and so much experience, we should take advantage of this.
Yes.
We should take advantage of the oxygen advantage.
Exactly.
Thank you so much, guys, and I really, really appreciate it. We work together also tonight, and I've seen what you do. Congratulations. I will bring my son to you, and I come also for the osteopathy, and I want to work with you because I want to breathe right and I want to sleep right.
Pleasure.
Thank you so much and God bless you. I appreciate it.
Thank you,
Thank you,
for
David.
your invitation.
Vă mulțumesc mult. Please, vă rog să vă abonați și ne vedem săptămâna viitoare. Mulțumim mult.